Bob Kyle is a giant in hematology, the godfather of plasma cell dyscrasias. He described the natural history of monoclonal gammopathy of undetermined significance and smoldering multiple myeloma. Many other contributions describing chronic idiopathic neutropenia, the MDS and leukemia that we see secondary to malphilan, idiopathic Bence-Jones proteinuria, and much work in amyloidosis, as well as amyloid and myeloma. He also carried out one of the first syngeneic transplants for aplastic anemia in 1964. In recognition of his international acclaim, he's had many awards, and I'll just mention the Karnofsky Award from the American Society of Clinical Oncology, the Waldenstrom's Award from the International Myeloma Workshop, and the Wallace A. Coulter Award for Lifetime Achievement from the American Society of Hematology. He's also had awards named in his honor, the Robert A. Kyle Lifetime Achievement Award, both from the International Myeloma Foundation and the International Waldenstrom's Foundation, and also the Robert A. Kyle Award for Outstanding Achievement in Hematology at the Mayo Clinic. He founded the International Myeloma Society, and he attended the first and all international myeloma workshops. Most importantly for me, I've gotten to travel the world with Bob and cherish his personal friendship. For me, he is a role model, a mentor, and a cherished friend. In addition, researchers, caregivers, and patients worldwide have Bob to thank for a better and longer lasting life.
Hello, my name is Jean-Luc Caruso from France. I met Professor Robert Kyle for the first time at the International Myeloma Workshop in Torino in 1991. At that time, he was 63 years old and was one of the 3 world experts in the field of clinical research on multiple myeloma, together with the late Daniel Bergzagel and Sidney Salmon. More than 30 years later, thanks to his extraordinary longevity, he remains a living legend in the history of myeloma. Everybody knows that he devoted his life to the study of monoclonal gammopathies, and he greatly contributed to a better understanding of the plasma cell disorder evolution, and he clarified the diagnostic and the prognostic classification of these disorders. He has been a great team leader and the mentor of prestigious myeloma specialists at Mayo Clinic Rochester, such as Phil Grape, Maury Gertz, Angela Dispensieri, Vincent Rajkumar, Shaji Kumar, and many others. He is a brilliant speaker, and he has been invited all over the world to deliver didactic lecture far beyond the age of 90. His career and his personality explain why he is so much admired and respected within the myeloma community. And I'd like to finish by a more personal anecdote regarding Bob Kyle, the man. He was in Nantes, my city in France, for a lecture. He had 2 hours free, and instead of having some rest after a long trip, he asked me to show him around the city. And I was impressed by his knowledge of art, architecture, and even French history. He is polite, discreet, pleasant, and cultured man. He is a great man, a great doctor, a great leader. Thank you, Bob.
Bob Kyle is probably the most respected person in the myeloma field, not only for his scientific stature, but mainly for his personality. He has always tried to find what joins people instead, what separates us. For him, the competitor has never been a doctor working in New York, Houston, or London, but this terrible disease called myeloma. This is well reflected into his capacity to collaborate with other investigators, both sides of the Atlantic, but probably even more important is his immediate response when a colleague asks him for advice about a difficult patient that has been diagnosed from Chile to Nigeria. Dr. Kyle has made seminal contributions in all spectrum of monoclonal gammopathies, from the so-called benign forms, the MGUS, to the most aggressive one, the plasma cell leukemia. He has defined the criteria for differential diagnosis and risk of progression, the clinical significance of apparently innocent paraproteins and treatment regimes that has been a standard of care for decades. Are these the most relevant merits of Dr. Kyle? 40 years ago, I read a phrase that profoundly impacted me. This was the sentence: do not let your life be sterile, be useful, blaze a trail, leave a legacy. For some people, his goal in the academic career is to be highly productive and to reach the maximum recognition by the society. But most of the time, this is ephemeral. And what truly remains is the capacity of mentorship, to be able to make people grow, to generate working groups, to serve the others. And Dr. Kyle is a role model in this field. Jean-Paul Sartre used to say, happiness does not consist on doing what do you like, but liking what do you do. And once again, Bob Kyle is a model on how to enjoy work and life. Thanks, Bob, for all these outstanding contributions and lessons in favor not only of the myeloma community, but particularly for the myeloma patients. Thanks very much.
Hi, I'm Vincent Rajkumar. I work at the Mayo Clinic in the Division of Hematology. I've been fortunate to work with Dr. Kyle for many, many years. Dr. Robert A. Kyle is a role model in the field of multiple myeloma. He has worked for more than 60 years in this field. He has defined monoclonal gammopathy of undetermined significance and smoldering multiple myeloma. His work forms the basis for a lot of what we know in the whole spectrum of plasma cell disorders in terms of epidemiology, disease definition, risk stratification. I'm very pleased that we are honoring him today in this Standing on the Shoulders of Giants webinar. There's a lot that can be said about Dr. Kyle. He has over 1,000 publications. He's been publishing in this field for 6 decades. But what I want to focus on today is some of the special qualities that I have learned from him. Number one is his vision. He set out to start the biobank at the Mayo Clinic and the database years ago, decades ago. And that has allowed people like me who came after him to do research in this field and produce new findings that would not have been possible had he not had the vision to set up these databases and biobanks whose value I cannot state in words. Second is his mentorship. He has really been selfless in mentoring so many of us at Mayo Clinic. It's very hard to find 2 or 3 leaders in any one institution who are specialists in one field. But at Mayo, we have more than 10, 15 at the professor level focused on myeloma because of Dr. Kyle's selfless leadership and mentorship. More than just the Mayo Clinic, he has mentored clinicians from around the world through the International Myeloma Working Group. And finally, I want to highlight his integrity. When Dr. Kyle speaks, everyone listens because we know how much trust we can place on his words. His work will stand the test of time. Decades later, we'll still be using what he has published. And he will continue to always be a role model for us in the field as well as in medicine in general. I'm just so fortunate to have worked with him closely in the Mayo Clinic as well as on the Scientific Advisory Board and the Board of Directors of the International Myeloma Foundation. Bob, thanks for all you've done for the field of multiple myeloma and related disorders and for medicine.
Hello, I'm Nikhil Munshi, and it's my pleasure and privilege to be part of this celebration of Dr. Robert Kyle's achievements in life. This award by the International Academy of Clinical Hematology, standing on the shoulders of the giant, is one of many recognition that Dr. Kyle has received. As we all know, he has been mentor, he has been colleague, he has been our supporters for a long, long time. In all our careers, Bob has contributed to our advancement and our progress. I can go on discussing and talking about his achievements, his numerous publications, his many, many papers in New England Journal of Medicine, his contribution from describing the disease to treatments, diagnosis, new drugs, comparisons. He has contributed to every aspect of myeloma. All our careers have been based on Bob's initial descriptions and also ongoing work. And so recognize his achievement is but obvious. And many others are mentioning about his careers and his accomplishments. I would just highlight one point. What Bob does, he reaches to the highest level. He strives for excellence. That's what I have learned from him. And the example I would give is about his interest, his outside interest. And believe me, Bob has other interests outside myeloma. And this particular interest is about philately, collecting stems. Bob got interested earlier on in collecting stems. Like everything he has done in his life, he focuses on things. And his focus was collecting stems about medicine. And just to highlight how he reaches to the level of excellence, he involved himself in this particular interest so much, he became president of the medical section of the American Philately Association. He reached the top, accomplishing the most. What it tells us, educates us, is we need to focus, we need to reach to our most potential and achieve the excellence. We have many things to learn from Bob. This is one example of how he has affected us. I would like to congratulate him on this award, and we are so very thankful for all his contributions. Thank you very much, Bob, and I wish you the very best.
Hi, I'm Mohamed Moti from the Sorbonne University and Saint-Antoine Hospital in Paris, in France. And it is my great pleasure to welcome you to this new activity by the International Academy for Clinical Hematology. In a letter to Robert Hooke in 1675, Isaac Newton made his most famous statement: If I have seen further, it is by standing on the shoulders of the giants. Standing on the Shoulders of the Giants initiative by the IACH aims to celebrate the achievements of leading experts and investigators whose work and research have helped to significantly advance the field of clinical hematology and establish the milestones and foundations of modern clinical hematology. The IACH Scientific Steering Committee will choose the honorees from different fields of clinical hematology. All IACH members, friends, and supporters are also encouraged to propose names. The steering committee will ultimately choose among the proposed names based on each nominee's body of work, including strengths of research, clinical impact, significant educational contributions, and overall accomplishments. Our honoree today is Dr. Bob Kyle, who is a living legend in medicine. The scientific contributions of Dr. Kyle over a remarkable 60-year career in medicine have no parallel. This is why we are very proud to have you with us, Dr. Kyle, today. So, Dr. Kyle, before going into your scientific achievements and many other questions I have to you today, I wonder if you can tell us something about your early childhood and early educational experience and how that might have played a role in your selection of scientific and medical fields.
Good morning, Mohammed. Thank you very much for those very kind words. I was born in North Dakota, which is a state that borders Canada, and it is in the middle of the United States. My father ran a tire repair shop, but after several years, decided that this was not a very healthy occupation, and so he bought a farm and moved there near our hometown of Bottineau. I then went to a one-room country school that had 8 grades, and at the end of the 8 grades, one had to take state examinations in order to proceed to high school. During that time, my mother was visiting with the neighbor, and she asked or made the point that, Bob is a very good student. What does he plan to do? And my mother said, well, gosh, I don't know. And then she said, well, why doesn't he be a doctor? And that was the very first seed. And as I thought of that, that sounded good. I enjoyed school and did well. And actually, I've made the statement several times that I would rather go to than I would to work. So I continued on. And after high school, went to a junior college called the North Dakota School of Forestry, which was located in Bottineau. And there I studied pre-med and not forestry. However, I did work for 2 summers as a lookout fireman in one of these towers that you see in the Rocky Mountains looking for fires. That was fun, but wasn't a full-time interest of mine. I continued in pre-medical studies, graduated from the University of North Dakota, and the dean of the medical school interviewed me. There was a 2-year medical school in Grand Forks, North Dakota. And the dean told me that the 2-year medical school was in a building that was to be condemned because of unstable floors and that sort of thing, and said, you know, you're a good student, your MCATs are very good, we'll take you here, but I would suggest that you go to a 4-year medical school. And then he went on to say, if you want to be a professor, go to Harvard. If you want to do research, go to the University of Pennsylvania or Johns Hopkins University. But if you want to be a real doctor, go to Northwestern University Medical School in Chicago. Well, obviously at that time, I wanted to be a real doctor. So I applied at Northwestern and fortunately was accepted. I enjoyed medical school, all aspects of it, although by the end I had decided to study internal medicine. So I took my internship at a hospital in university hospital in Chicago that specialized in internal medicine. And then I applied to the Mayo Clinic because I had been told that it was the best medical school or the best program for internal medicine. At that time, I want to emphasize that internal medicine was considered a specialty. And one would take his 3 years and then take the boards and be a practicing internist. Well, I finished I began my training in Rochester, but after a year, I was drafted into the United States Air Force and spent 2 years in Alaska. It was a very good place because I was in a 400-bed hospital, and I ended up with a major medical ward in that hospital. So I saw a lot of disease, and more importantly, was the doctor. And so I had to manage a lot of things. I learned a lot. I returned to the Mayo Clinic, finished my fellowship, and during the last year of my fellowship, I took the hospital service on hematology. And there, the consultant on the service showed me an electrophoretic pattern. And I said, what is this? I have never seen one before. And he said, well, it's a new test, and why don't you look into it? So I reviewed the 3 years of laboratory output of some protein electrophoretic patterns and recognized that patients with multiple myeloma or Waldenström had a large spike in the, and so I described all of this and defined the spike that had a high ratio of 4:1 or greater, and found that these patients, when I reviewed them, all had Waldenström's macroglobulinemia, or more commonly, multiple myeloma. And
Bob, let me, we'll talk about this. So since your first publication in 1959, actually, you have defined and redefined the epidemiology, the diagnosis, the risk stratification, the prognosis, and the entire management, the management of the entire spectrum of gammopathy of undetermined significance. But I mean, that's really fascinating from the one-room school you mentioned to Mayo Clinic reviewing the electrophoresis. Can I ask you about whether there was any particular teacher, faculty that you thought at the time to be exemplary of the academic tradition, and you wanted to follow on the same path?
Well, the most influential person was a man named Ned Baird, who had written about myeloma or described the morphology in great detail. And he is the one who said simply after I saw the electrophoretic pattern, he simply said, look into it. And that's what led me to review the electrophoretic patterns. On that same hospital service, there was a patient with multiple myeloma who was admitted, but she didn't have holes in her bones, severe anemia, and the like. And so the clinician who had seen her initially and sent her to the hospital did a biopsy of the skin. And that skin biopsy was read as primary amyloidosis. Now, I had never, all I could think about was amyloidosis. That's something that we saw in pathology and saw a slide of tissue that showed a glassy sort of appearance, no cells or anything like that to speak of. And and I had never recognized a case of amyloid prior to that, despite the fact that I had had 3.5 years of internal medicine at the Mayo Clinic. I'd had these 2 years in a medical practice in Alaska, and this was the first time that I had seen this disease. I realized that I didn't know anything about it, so I reviewed all of the cases of amyloidosis at the Mayo Clinic and described the 80 or 81 cases of primary systemic amyloidosis. And that was the start of my studies. This led to the monoclonal gammopathies, as you mentioned, and has kept me occupied for the past 60 plus years.
Can I, well, again, this is really amazing. So you started the whole story by reviewing all of the electrophoresis charts. Can you tell us a little bit about the structure of the hematology field back in the 60s when you started your research in this field?
Actually, in the 60s, I was involved with the National Cooperative Group, Acute Leukemia. And I actually, during the 60s, saw a lot of acute myelocytic leukemia. And I was going along, I became curious. I didn't see very many of those patients return to see me. And I looked at the records and emphasized that the Mayo Clinic record system is quite remarkable. I was able to look at histories of the previous 50 cases of AML and found that all of them died within years. And so that was an eye-opening experience and exposed me to the fact that at that time there was, quote, no treatment of significance that was available for acute myelocytic leukemia. Melphalan had been recognized in the late 1950s in Russia, as a matter of fact, and then moved to Europe and to David Galton in London, and then finally to the United States. But I would emphasize that things did not move nearly as quickly at that time from a scientific standpoint as they do today.
Can you tell us a little bit about the sort of research and clinical problems the people were debating in the field of blood and bone marrow diseases when you started your interest on these gammopathies?
Actually, one of the major areas were the isotopes. And in fact, I was told in medical school that the 1-hour course that we had on radioisotopes, which would have been at about 1947, was the first course taught on radioisotopes to medical students at that time in the United States. So that was one of the things, and radioactive iron was used to study blood loss, for example, and that sort of thing. But I never really became involved with the radioisotopes from a research standpoint, but was occupied with the serum protein electrophoretic patterns.
So are there any people who were active in research at that time that you would like to comment on and that had a particular influence on you and on your research?
Well, actually, the head of clinical pathology was a person named Chuck Owen, O-W-E-N, who was head of clinical pathology. He had trained at the University of Iowa, as I recall, and was a fantastic teacher. For example, he was particularly interested in the field of coagulation. And coagulation was always a very confusing field. And after a 1-hour lecture by Chuck, it was really suddenly very clear. But within a few days, things clouded over, and I was no wiser than I had been before. It was really a very frustrating area as far as I was concerned. And I wasn't the only one. Most of the students, young consultants, and so forth felt the same thing about coagulation, unless they happened to be working and doing research and so forth in that particular field.
So coagulation was definitely not your cup of tea. But could you go into a little more detail about the intellectual interactions that took place at Mayo Clinic when you started this new field of your research that you have almost invented, I would say?
Well, actually, at Mayo Clinic, when I started in the program, it consisted of a series of lectures that were given on Monday and Thursday evenings. And we were told that if one attended and listened to those lectures, that he or she would pass the American Board of Internal Medicine without any problems whatsoever. And again, I want to emphasize that internal medicine was the subspecialty of choice. It was like surgery, and I didn't like surgery or wasn't interested in it. And so this was just good. And then on Tuesday evenings, we had a year of seminars in medicine. And then in our second year of training, we had seminars in physiology. And in both of these instances, a fellow gave one of these presentations during the whole academic year. So you would spend a lot of time in preparation. And then at the end of the year, they published the papers. And so over a year's time, you had a very good exposure to internal medicine. Now, when it came to physiology and time to select my project, I really wasn't interested in the intricacies of cardiology, because at that time, open heart surgery had just been started here at the Mayo Clinic and at the University of Minnesota. I don't think it's ever been resolved who was really first. Depends on who you listen to. But in any cardiology, and cardiac catheterization was a big area. And that was the physiology curriculum. One of the, at the time, the areas that the fellow would concentrate on and give his seminar would be pathology. And it didn't look to me like pathology would be very interesting for 6 months. And then one would need to select a project and write a thesis, which subsequently was examined by the University of Minnesota Graduate School. One had to go to Minneapolis and was interviewed by the committee. And that was a rather traumatic experience. There were a lot of stories about how things went for many people. Fortunately, I was fortunate and was asked a number of questions that I happened to know the answer. But in order to get that master's degree here, one had to do that thesis, defend it, and then write the paper and publish it. And my paper was on hemolytic anemias. And that's how I got started, or that's my start in hematology. And then it was only after that that I took that hospital service and then was introduced to multiple myeloma and amyloidosis, as I've already mentioned.
So you mentioned fellows and students and myeloma. So you have trained dozens of myeloma doctors at Mayo in the US, but also across the globe. Did you see yourself playing the role of influencing physicians in any way, moving towards this field of myeloma and gammopathies in general?
Yes, I wanted to interest them in the field because there were not very many physicians who had a lot of experience in the area. You can imagine that most people at that time were general internists. And as you well know, hematology accounts for a small percentage, very modest percentage compared to cardiology, gastroenterology, pulmonary disease, and the like. And so I would, and then the other thing that we did here was when a fellow left and went into private practice, and he would have, or she would have, a patient with multiple myeloma. Oftentimes they would call me and say, well, gosh, how should I handle this? Or what would be the best way of treating this particular patient? So I took a lot of those calls, particularly about patients with amyloidosis, because no one had had much experience with it.
Well, I think that brings me to another key question, Bob, because your work has made a huge difference in the life of thousands and thousands of patients worldwide. This is why I'm very interested in your relationship with patients and how looking at a particular disease, symptoms, or whatever has influenced the sort of questions that you have chosen to ask in your work over the last 60 years or so?
Well, I have always said that patients have taught me everything that I know. And for example, if I saw a particularly interesting individual, and the idea for for monoclonal gammopathy of undetermined significance actually was first in a patient whose history I reviewed when I was looking at patients with multiple myeloma in the 1960s. I collected all of the patients here, and that's the paper that I published emphasizing the serum protein electrophoretic patterns of those individuals. And so each of those patients, for example, the major patient was a person with multiple myeloma. And this individual, as I reviewed her Mayo Clinic patient, I noted that this patient had been to the Mayo Clinic in 1945. She came complaining of weakness and fatigue, which many patients obviously complain of. And the internist, or actually hematologist who saw her, ordered a serum protein, actually serum protein electrophoresis was not available in 1945, but he ordered an albumin globulin ratio, which had been done since the 20s, and the globulin level was elevated. The patient had a sedimentation rate of over 100 millimeters per hour. But the patient clinically looked well. The rest of her laboratory work was quite satisfactory. And wisely, the internist who saw her at that time did not treat her. She returned about 15 years later, at which time electrophoresis was available, and an electrophoretic pattern was done, showed a spike of 2.9 grams per deciliter, which I had already, in defining multiple myeloma and defining monoclonal gammopathies, I used I picked a 3-gram point. Above 3 grams was multiple myeloma, below 3 grams was something else, and this something else was represented by this woman who had a monoclonal gammopathy of undetermined significance, actually. So then she was followed, and then about 8 years after the electrophoresis was done, she developed severe back pain, and it was obvious that she had multiple myeloma, many lytic lesions, and was treated with cyclophosphamide in that for that particular patient. The only choices were cyclophosphamide or melphalan, and she had some benefit. The protein went down a bit, but her disease progressed, and she died about a year and a half or 2 later.
So now we know the whole story about this MGUS patient. So let me move into a more personal question, Bob. I was wondering if you could say a few words about the contribution of your family during your career, and what was the role? I remember, I think I met with your oldest son a few years ago in Paris when you traveled together.
Yes.
Can you please feel free?
Yes, I met my wife, Charlene. She was a nurse at the hospital that I interned in. She had had 2 years of college and then entered the 3-year nurses training program. And with that, she obtained her bachelor's degree. And when she finished her training, she came to Rochester as a nurse. In fact, she was the first radioisotope nurse at the Mayo Clinic. And I had, as I mentioned, had known her as a nurse in Chicago, and continued together and married a year later. And it was in Alaska that we had our first child, John, the boy that you met. He became a teacher, actually, a high school teacher, and taught sciences and developed courses in the solar system. He had another one on stars and so forth, and oh gosh, there was another specialty. Meteorology. That was it. He developed that, and he continued teaching in this same high school, which was a suburban community near Minneapolis, and retired. And he's now, as a matter of fact, he's actually in Australia visiting friends.
So you couldn't attract
second
him to
child-
myeloma. So you couldn't attract him to the medical field.
No, he was not interested in medical school, but he was interested in the sciences. And Charlene and I realized that it would be wise to have the child select what they want to do. I have personally seen, and I'm sure that you have too, seen people who have gone into medicine simply because their parents or grandparents or someone like that was behind and pushing, and in order to keep peace in the family, so to speak, the child studied medicine, but was never consumed like it, by it. So I think that that's an important thing, is that your child do what they want. And so our second child graduated in environmental sciences. And we said, Mary, what in the world are you going to do with that? And she says, oh, I don't know, but I like it. And so I said, well, you're going to end up running a park in the summertime. What are you going to do the rest of the time? And so she said, nah, it won't work. So she married one of her classmates, and he became a PhD in soils and worked for a large research company called Battelle in Washington State. And so Mary looked around, got a job her husband was getting his PhD, looked around, got a job in a laboratory. And the professor was a professor of soils chemistry. And he'd say to Mary, well, we need to do this experiment or that experiment. And Mary'd say, oh, fine, fine. And if she couldn't read up on it, she would go to a laboratory down the hall or something, learn how to do it. And so after a year, he said, well, how would you like to get a master's degree in soils? Mary said, fine. And so he arranged her work schedule so that she could take the necessary classes. And then she did a project on growing alfalfa, it was, and the effect of minerals added to the soil. And so she proved that phosphates were necessary to grow good crops. And so she then by that time, she was pregnant with her first son, and they moved to the Tri-Cities of Washington, where where her husband worked in the scientific field, and she was going back to work after the first child, but then she had a second child about a year and a half later, and so then she had a third child, and she simply stayed home and took care of the kids and participated in their sports activities. They played a lot of baseball, a lot of soccer, and were on traveling teams and all of that sort of thing. And then one day at the age of 49, she said to my wife and myself, you know, I'd like to be a nurse. And we said, a nurse? And so she then took nurses training at a hospital. And after finishing the training, they said, oh gosh, you ought to stay another year and get your Bachelor of Science in Nursing. And Mary said, good grief, I've got a bachelor's degree and I've got a master's degree, and I'm past the age of 50. I want to go to work. And she did. She ended up working in an orthopedic hospital and became an expert on nursing patients who had knee surgery, shoulder surgery, and that sort of thing. And then after about 10 years, she retired because by that time, her children were married, and now she's very, very busy with children and grandchildren.
So actually,
and then our youngest, got to just mention Jean, Barbara. Barbara, our third child, was interested in nursing, became a pediatric nurse working with these little babies the newborns and all of that. Did that several years, and now then she ran the teenage pregnancy program in Hennepin County, Minneapolis, for a number of years, and now she is in public health and has a large division that she's responsible for the study of the health of the Hennepin County high school students. And then our youngest actually didn't know what she was doing and got a bachelor's degree in women's studies and so forth and criminal justice, and soon realized that those were not very welcoming fields to people. And so she studied law and is now and has been a public defender in Hennepin County, Minneapolis for the past 25 years. So our children, in a nutshell, and many patients have said, are you have doctors? I say no, and tell them that I want the children to do what they want to do, not what I want them to do. And I think that's good advice for anyone who has children. Let them find their way.
Well, definitely the story of your children is a good example of this. And one of your daughters managed to go to nursing school at age 49 or 50. So today, what would be your advice?
Could you bring the mic a little closer to you?
Yes, what would be your advice to the younger generation of doctors who want to be involved in myeloma and gammopathies?
All right. I would tell them to begin seeing all of the patients in their practice. I'm talking about an internist who has an interest in multiple myeloma or has some touch after leaving here, for example. They have an interest in myeloma. I encourage them to continue in the field. If they have gone to a university and are on the faculty, to work with other persons in that field and develop the area that they find interesting and satisfying to them. Because if you're not interested in really vitally interested in what you're doing, it's going to be work. For me, it's been fun, interesting. Long days, many times, but well worth it.
Well, this is fantastic. And it's about passion. But is there anything that you would have done differently in hindsight, Bob?
Not really. I've enjoyed each phase. I enjoyed, although frustratingly, the leukemias in the 1960s. That was not a very satisfying from the aspect of a treating physician, but I am persistent. And I just kept going. And of course, the monoclonal gammopathies of undetermined significance, I've seen them go 40 years without any change. But again, the monoclonal gammopathies have showed me that 1% of those patients each year will progress to multiple myeloma, and that has been borne out with continued experience. And the patient with smoldering multiple myeloma, 10% of those patients progress during the first decade, and then they fall off after that and progress. Ultimately, after 10, 15 years, they're progressing at 1, maybe 2% per year, something like that. It all fits so beautifully, I think. And the other thing is that I want to emphasize that I have seen patients virtually every day until my retirement. I retired from seeing patients when I was 72, going 73, I guess, something like that, and then worked in the special protein laboratory, which I had founded 40 years before, for another 5 years. And then my colleague, Jerry Katzman, who had been with me for, 15 or 20 years, took over the laboratory, and I was very happy to have him continue to do so. And now he's retired, and another person has taken over and introduced a whole new area of mass spectrometry in the diagnosis of the monoclonal gammopathies. So it's no longer plain electrophoresis with that familiar spike.
This is really amazing, Bob. Your attention to details. I think a couple of years ago in one of his editorials, Vincent Reshkumar mentioned that the main characteristics of Dr. Bob Kyle are about attention to details. Your vision.
I'm sorry?
Attention to details.
Yes.
Your vision, your mentorship, but also your integrity. I think you are a role model for all of us. I have one last question to you, whether you remember when we first met.
Yes, go ahead.
In 1993, when you visited Montpellier, and I was a medical student, and you wanted to visit the old books at the medical school, to see the old books, because that was the oldest medical school, among the oldest one in Europe. Do you remember this episode?
Yes. Yes, I do, and I have enjoyed all of my visits to particularly libraries and the like. And I recall one in particular that had so many publications from the 17th, 16th century and so forth, and they were just commonplace. Here at the Mayo Clinic, in our library, they would be in a very special, air-conditioned, appropriate humidity, temperature, and all of that sort of thing. But there they had so many of these things that they didn't know what to do with them, actually.
Thank you very much.
Bob. The other thing I would just mention is that I have all immensely enjoyed travel. And I am just completing my memoir, and I have a special last chapter that tells of visits to various places like Easter Island, where I went with my son. And that island, for example, is only 7 by 15 miles in size. And my son, who researches visits like this very, very carefully, makes all the arrangements and the like, scheduled us for a week on Easter Island. And I said, good grief, that's crazy. But he was absolutely right. We were busy every day visiting and revisiting the various sites. the Galapagos Islands, wonderful area. The Arizona or the Amazon jungles, Antarctica, Cyprus, and Russia, a lot of very, very different places that I've been privileged to visit, and those are always highlights in my life. I would always take a couple of weeks of vacation every year just to travel to these out of way areas. We've driven, taken a lot of driving trips in this country. We visited all of our, virtually all of our national parks and places like Yellowstone. We've probably been there a dozen times. So we are all travelers in the family.
Well, thank you very much, Bob. You are an international treasure for all of us. You are a living legend, and we are always very grateful, whether we patient or physicians or healthcare professionals, to your countless contributions to patient care, to the field of multiple myeloma and gammopathies, to medical education, to research, to mentorship. Thank you so much. It has been a true pleasure having this discussion with you, and I hope that you have enjoyed it as much as I learned from you today.
Well, thank you very much, Mohammed. I greatly appreciate the opportunity to speak. And sometimes when you get me going, I fail to stop. So this has been a very enjoyable interview, and I hope that others like it as well. And if there are any questions by anyone, I would be more than happy to attempt to answer them. So thank you very, very much for this opportunity, Mohammed. It is greatly appreciated.
Thank you very much. Please stay safe and keep well.
Thank you. And the same to you. Goodbye.
Bye.